Hi, my name is Maddie. I'm going to be your nurse today. I'm going to be performing a head and neck physical assessment. Is that okay with you?
Yep.
Okay, can you tell me your name?
Glenn?
Okay. All right, Glenn, thank you for being my patient today. Are you comfortable where you're sitting?
Yep.
Okay. I performed hand hygiene and I provided privacy for the patient. So on my first inspection, I'm going to say that his skin is appropriate. The skin color is appropriate for ethnicity. His posture is good. His hearing seems to be intact. And his speech is appropriate. Mood affect is also appropriate. And no obvious physical deformities. So now I'm going to move into the assessment of your head. I'm just going to inspect your scalp. Have you had any problems with your scalp or your head lately?
No.
Okay, great. So I'm just going to look for patterns of baldness, and I don't see any. Hairs evenly distributed on the scalp. No dandruff. Okay. Next, I'm going to palpate your cranium and your scalp, and you tell me if there's any tenderness or anything like that. There's no bumps, lesions, and no tenderness?
No.
Okay, great. Next, I'm going to move on to your face. So can you show me some facial expressions to make sure that they're symmetrical? Can you smile for me? Frown? Okay, great. So that was cranial nerve 7 that was just tested. Now I'm going to palpate your TMJ, so if you can open up your jaw for me. Good, and close. Okay, great. No popping or anything like that was detected. So can you clench down your teeth for me? Great. Good TMJ muscle strength. So I'm going to test your facial sensation. So I'm going to touch you with something soft and touch you with something sharp. And you tell me which one is which. Can you close your eyes? Okay, great. 1.
Soft.
Okay, great. 2.
Hard.
Okay, good. That was cranial nerve 5 that was just tested. So I'm going to place my hand on your cheek, and you need to push into my hand with your head, okay? Go ahead. Good. On the other side. Awesome. So good cervical strength of the spine. That was cranial nerve 6 that was just tested. Now I'm going to check your eyes. So I'm going to grab my pen light. Can you remove your glasses for me, please? Thank you. Check your conjunctiva. Good. Good. Conjunctiva is pink, moist, no excess tears, no dryness. Sclera is white, which is normal. I'm going to check your visual field. So tell me when you can see my fingers.
I can see them.
Okay, great. Good peripheral vision. That was cranial nerve 2 that was tested. I'm going to assess your eye movements through 6 positions. Can you watch my finger while looking without moving your head? Great. So that was cranial nerve 3, 4, and 6 tested. Now I'm going to check your visual acuity. So can you cover one eye for me? And can you read the Snellen chart that's 20 feet away from you and read the smallest line that you can?
I can see the bottom line.
Sure, go ahead, read that one.
RXTVU.
Okay, and how about the other eye?
RXTVU.
Awesome. So 20/20 vision in both the right and the left eye. You can put your glasses back on. Actually, just kidding. I need to check your pupils first. Sorry about that. Looking for equal constriction in the light. Good. So pupils are equal round, reactive to light, and accommodation, which is normal. Next, I'm going to inspect your ears. So first, I'm just going to check for symmetry, make sure they're on the same level. The outer ear is good. No pain, tenderness, redness, swelling. And then I'm going to take my otoscope and look inside your ear and see that there's not much cerumen and the eardrum is pearly gray. Make sure it's the same on this side. Pearly gray and not much blocking your ear canal. Great. So I'm going to use a whispered voice, and can you repeat what I'm saying to you in your one ear and then the other? Yes?
Yes.
Okay. Thank you.
6. 7.
Great.
Great. 11. 12.
All right, great. So now I'm going to use my tuning fork to put it on top of your head, and I want you to tell me which ear you hear it out of, or you hear it out of both. Okay?
Okay. Both.
Great. So now I'm going to take my tuning fork again, and I'm going to put it on the back of your ear or in the front of your ear, and you tell me which one you hear it better. Front? It's the back.
Front.
Okay, I'm going to check the next ear. Front?
Front.
Great. Air conduction is greater than bone conduction, so that would be a normal test. That would be cranial nerve 8 that was just tested. And now I'm going to move on to your nose and sinuses. Have you been having any issues with your nose or sinuses lately?
No.
Okay, great. So first I'm going to check for symmetry. Symmetrical. No runny nose, no other issues it seems to look like from the outside. Can you test the patency of each of your nostrils? Can you hold one side and blow and then hold the other side? Great. Awesome. Clear in both nostrils. So can you tilt your head back so I can look in your nose, please? Okay, great. Pink, normal tissue in there, no lesions. Now I'm going to palpate your sinuses for tenderness. Can you remove your glasses for me? Thank you. Any tenderness with that?
No.
Okay, great. I am going to inspect your lips and your mouth now. No visible dryness on the outside of the lips. Can you open for me? Oral mucosa is pink, moist. Good. Now I'm going to ask you to stick out your tongue and say ah for me. Okay, great. So, no, the vulvular movement wasn't anything abnormal, stayed in the same spot, just went up. That was cranial nerve 9 and 10 I just checked for. And now can you stick your tongue out for me again? No deviation. That's cranial nerve 7 that was just tested. Now I'm going to move on to the inspection for your neck. So I'm going to palpate your lymph nodes for masses or anything like that. No palpable lymph nodes, no masses. And then I'm going to palpate your trachea from the back and your thyroid. Can you swallow for me? Great. Thyroid moves when swallowing, so that's a normal finding. I'm going to palpate your carotid arteries, and then I'm just going to listen. Great. Good. Now I'm going to listen. Okay. No brewy heard on the left. And no brewy or swishing happening on the right either. Thank you for being my patient today. I'll have you sign some paperwork, and then you'll be out of here. Thank you very much. Do you have any questions?
Nope.
Okay, great. That'll be the end of my exam.
Thank you.